Today we're talking about PRP therapy, which stands for Platelet Rich Plasma. Our body has its own natural defense and healing mechanism, and these things are floating around in our bloodstream at any given moment in case they need to be called into action. Let's say, for example, you get a little cut on your finger. There's this coordinated cascade of events that happens. The body knows how to do all this healing, and it's initiated with these things called the platelets. So what the process involves is taking a sample of the patient's blood, and through a special filter, we take the blood sample and we spin it down, and we get it separated into two parts. There's a part at the bottom that looks more red, and that's where the red blood cells and the white blood cells are. And then there's another part at the top that's usually this nice golden color. And that's what we're looking for, what we call the liquid gold. And that's where the platelets and the plasma are at. Then we draw off the platelets and the plasma, and we do a second spin to further concentrate those platelets and other growth factors. And then that stuff is the platelet rich plasma, the PRP. And that stuff can be used for many, many different things that they're finding. And we have our patient today that we're going to be using this PRP therapy for hair restoration. Using the PRP on the skin with a special device called a skin pen or microneedling. And what that involves is with the skin pen, putting many little controlled injuries in the surface of the skin. But we're able to use the PRP and do injections in the scalp, and over a series of appointments and time, usually in a period of about 5 to 6 months, we start to see some hair growth and reactivation of the hair follicles that have been dormant.